Hello, everyone. I'm John Lynn, the founder and chief editor at Healthcare IT Today. I'm excited to bring you this interview with Dr. Art Papier, he's CEO and founder at VisualDX, and Dr. Neda Ebelik, director of clinical impact at VisualDX, and also a clinical associate professor of dermatology. Welcome, Neda. Welcome, Art.
Great. Thanks
Thank
for
you.
having us.
Thanks, John.
Yes, I'm excited to have this conversation, and it really is. It was prompted by some work you're doing around the data and making sure the data, is really representative of clinical populations. So we're going to get to that, a little teaser for those that are watching the video. But before we get there, tell us a little bit about yourselves. Art, you want to start?
Yeah, I'm an associate professor of dermatology, but my career has really been focused on medical informatics and improving decisions in the exam room for patients and also at home. And so I've led the development of VisualDX, which is a point of care decision support system.
Awesome. Great to have you here. And Neda?
Yeah, so I'm also an associate professor of dermatology, and my clinical and research interests have been in skin of color, as well as pigmentary disorders and diversity in medicine. And so I've really had an interest in blending these areas and really working to reduce healthcare disparities. And that's what brought me to my work with VisualDX and working as director of clinical impact.
Awesome. Well, I'm excited to have this discussion, and I think I'm going to learn a lot from it, which is my favorite interviews. So maybe you could start, Art. For those that aren't familiar with VisualDX, how does it work and what does it do?
Well, the premise of VisualDX is that we can augment our thinking in the exam room, that medicine has gotten way too complex to memorize it all, and that we can give physicians of any kind a consultant over their shoulder instead of having to refer patients. Often patients are seen, say, by a primary care physician or emergency physician who just needs a little bit more information to solve the problem, to figure out the differential diagnosis or the best test to order or the treatment. So you simply can use VisualDX, integrate it into the electronic health record, or on its own through a web app or on mobile apps by searching by your patient factors. And so we started with dermatology for the non-dermatologist, and it grew over the last 20 years to include any chief complaint in medicine. So we can really expand the differential diagnosis and start to reduce some of the cognitive biases that are occurring in medicine today.
Yeah, so there's a lot to unpack there. Neda, maybe you could take the first piece of it that you talked about, which is, I guess I would frame it, isn't the doctor's training enough to let them do this? Like, or is this just needed for advanced cases, or what are your thoughts there as far as, why do they need a tool like this? Haven't they been training for 20 something years, or however long med school is? It's long, right? What do you think?
Yeah, you're right. So a medical training is very long and extensive and exhaustive. But one of the things that many of us, Art and myself and others, have really felt for a long time is that medical training needs to be more comprehensive, especially when it comes to addressing disparities in healthcare. And a lot of those deal with socioeconomic, racial, and ethnic disparities. And so, training varies depending on where you train. So some people trained in areas that are not very diverse. And so they may not have seen disease manifestations in people of different backgrounds. And for us as dermatologists, that really makes a difference because certain diseases can look different in different skin types and some can disproportionately be in certain backgrounds. So if you've never seen it and you've never been trained in it, despite spending thousands of hours in medical training, you may miss certain conditions or may undertreat just due to a lack of awareness and knowledge. So this is where a tool like VisualDX comes in, and it's so powerful because you have access to it no matter where you are globally. And it has such comprehensive information that's scientific and evidence-based, and that's so diverse. And so even if you're in a rural area where maybe you've never seen, a certain disease, or you've never seen it in a certain person or color or background, you can look it up even at the bedside. And you have photos, information, everything right at your fingertips. And so we really feel that this can have a very powerful impact on improving training. And as physicians, we're kind of always in training, even after we finish our residencies. And so that's where we think it really has longstanding benefit.
Do you have any examples of that where, you know, maybe they hadn't seen a patient of a certain color or whatever it might be that, you know, they wouldn't know that that's what they needed to do, as you mentioned, because they trained in a less diverse population?
Sure. So, you know, as an example, which can actually have really profound effects on morbidity and mortality, is something like melanoma. Melanoma is skin cancer, which can be deadly depending on when it's caught. And melanoma can present in so many different forms. There's a specific form called acral lentiginous melanoma that we see more in populations of color. And so if somebody possibly hadn't been exposed to, you know, this training or experience or seeing this melanoma, and it tends to, I should add on, present on nails, palms, or soles. Someone could present with pigmentation on a nail that could go misdiagnosed. Someone might think, oh, maybe it's a bruise, maybe it's blood, you know, and they may not realize that in that particular person of that background, they're at higher risk of potentially this lethal skin cancer. So, you know, that's a more serious example. There's more minor examples. Not everything is life-threatening, but there are lots of diseases that still affect quality of life. And if it's misdiagnosed or if it's undertreated, it really can have impact on the patient's quality of life.
That's a great example. So what's the workflow look like for a physician that wants to use this technology? You kind of described, it sounds like there's two modalities. You can integrate with the EHR or you can do it separate. You know, if they want it in the EHR, does the EHR have to integrate it? And how does that integrate? You know, what's the workflow look like for a physician?
Well, there's a few different workflows. So in the EHR, we're using a technique called Smart on Fire to integrate VisualDX into records such as Epic or Cerner or other records that use Smart on Fire. And one of the really important areas that we cover is medication adverse events. So I'm not describing drug-drug interaction. What I'm describing is the problem of the patient's on 10 or 12 different meds. They now have a new complaint, and your clinical question is the medication causing the problem? And so what we can do inside the EHR is grab the med list, the problem list, and represent that as a timeline in the record. And then you can just simply click on the med, say in the medication list. It sends it up to the cloud to our server, and we send back the drug reactions right inside the frame of the record. So this is a really important problem area in healthcare because, you know, the average hospitalized patient is said to be on at least 8 medications, and it becomes very, very complex to sort out, is the medication causing the problem? So that's one example how we integrate into the record. We also are used heavily on mobile devices, and you know, because we've aggregated the best medical images in the world, and we've trained these images in AI using machine learning, and we've trained it on light skin and dark skin, and that's part of this conversation, is that we need equity and we need to reduce bias in AI, and we've been very careful to do that. So you can actually take a picture on your iPhone or Android phone of a rash, and the software assists you in the evaluation of that patient. It doesn't diagnose for you, but it incredibly augments your skin exam and augments the differential. So we're big believers in that we're not replacing humans, but that we're putting in place a second opinion in your fingertips, whether it's in the record or on your phone.
So when you say it augments, do you mean that you take the picture and then it gives you 7 possible diagnoses, kind of like Watson did on Jeopardy, right? Here's the 7 options and here are the most likely options, or how does it approach that type of information?
Yeah, it does. Like it's a combination of clinical decision support and machine learning, where the user, say, is inputting the patient's age, the body location of the rash, whether there's fever or not, and the picture's analyzed. And actually, we have some pretty amazing machine learning algorithms that are analyzing the skin exam and the diagnosis. So the answers to the questions and the scores from the machine learning create a visual differential diagnosis. And then the end user can review the pictures and come to a conclusion. So it doesn't say it's 100% chance this is the diagnosis. What it does It expands your differential and focuses your differential on some of the most likely answers. But still, the clinician is in the driver's seat. So often in medicine, we have this problem of premature closure, where clinicians jump to the first thing that comes to mind. And we need to consider second and third diagnoses that might cause harm to the patient. So that's what VisualDX on the phone does. So it's both phone and web-based and integrated into the EHR.
Sounds like next you have to hit telemedicine. Do you think you'll ever go directly to the patient, or do you think it will always be a clinician tool because you need the clinician to interpret the data?
John, I'm glad you asked that question because we have this incredible patient app called AYSA, A-Y-S-A, that you can Google or search for it today in the App Store, iOS, or Google Play for Android. And what it is a self-triage tool for patients. And one of our important parts to our story is that we're not a company that believes that there's a silo for consumer health and a silo for professional health, that we've built our tools off the same platform. And we believe that the future holds an end-to-end experience where the patient at home can say to Siri or Alexa or to voice nav what their complaint is. The app can ask them questions, and it might end there. They might say, well, this is nothing, or they might end up at the physician's office. All that data that's collected through our consumer app can be moved over to the professional side because it's a single platform that we're working from.
I could just add to that, in addition to ISA and SkinSight, which are the patient platforms, VisualDX itself directly can connect the physician or healthcare provider to the patient through patient handouts. So there are thousands of very helpful, informative handouts that right at the bedside, you can basically ask the patient for their email, and with the click of a button, send them the information about the diagnosis that you're discussing with them.
That is such an important point. And VisualDX is also used for patient engagement by just sharing images in the exam room. And so often patients hear these Latin words from doctors, they're not really sure. And if they have a rash, for instance, or even the diagrams in VisualDX can be used to show them to the patient to say, you're not unusual. You don't have something that's that rare. It's actually quite common. Let me show you a picture that looks just like you. And in fact, what we've done is that we've made sure that you can easily select, say, if the patient is a patient of color, an image of the disease in a patient of color. And this is so important. Patients of color don't want to look at examples in white skin and be told by the doctor, trust me, this is you. Patients want to really see images that look like themselves.
Wow, that's a great example. So let's dive into that a little bit. The whole unconscious bias, I think, is what most people refer to it. Sometimes it's somewhat conscious, unfortunately, but we'll give them benefit of the doubt and call it unconscious bias. But so tell us a little bit about what you've done to make sure you have the data available to do this, and what was involved. What are some of the biases you saw, and how did you correct them, or how are you approaching that? Maybe you want to start, Nada?
Sure. So, I think one of the most impressive things that VisualDX has done is just collected an amazing database of images. And so part of, there's been a lot of recent articles in the lay press and also in our own peer-reviewed journals discussing the lack of diversity in images in our textbooks, in our online platforms, in our courses, where people just constantly are seeing examples of disease in lighter skin. And the reality is it looks different oftentimes in darker skin. So VisualDX for years actually has been collecting these images across all different skin types. And so they have thousands of images, nearly a third of which are in what we consider skin of color. And that's really an amazing volume. And so being able to have that volume of images for thousands of diseases really helps with reduction in bias, because people can look up a disease. It can be something as common as eczema or psoriasis, or something much more rare with a long Latin name, as Art mentioned. But you can find that image and see what it looks like across different skin types. And this is important on the provider side and on the patient side. And so, I use it, just as Art mentioned, to show my patients what it looks like in their particular skin color. But back to our original point about where you're trained, if you didn't train in a place where you got to see what eczema or psoriasis or any other disease looks like in darker skin, you can see it on a platform like VisualDX. And that has a very powerful impact in improving healthcare equity.
And John, this isn't just about typical dermatology diagnoses that most people associate with our specialty, like eczema or poison ivy or acne. We're talking about the skin signs of some pretty serious diagnoses. So often as dermatologists, we see some diagnoses missed because the ER physician or the primary care doctor didn't recognize what inflammation looks like on brown skin, or a leakage of blood into the skin on brown skin. So, diseases like bacterial infections causing sepsis. I mean, life-threatening conditions can first present on the skin, and the clues can be very, very subtle on brown skin. And we have a huge way to go in medicine, both going all the way back to medical school to start training students better and how disease looks in people of color. Like we at VisualDX have been purposeful over the last 20 years in collecting imagery from some of the really legendary teachers that were teaching about the presentation of disease in dark skin. And so, I actually published a paper in 2006 about the disparities in the dermatology literature. So this isn't new to us. Like we reached out to the people that really were the experts and the legends in our field to make sure that we could cover dermatology, not just about diagnoses that might be more common in people of color, but all diagnoses, particularly infectious disease and drug reactions. Because a lot of these serious conditions go unrecognized. And, I've said this before, that you wouldn't pass a medical student if they couldn't examine the heart and lungs. But we have many, many medical students that are going into specialties and general practice that cannot do the physical exam of the skin. And the physical exam of the skin is required to diagnosing some of these serious conditions.
Well, and I think it goes back to something you kind of briefly mentioned around confirmation bias. If your training hasn't informed you, then the clinical decision support, or what your observations go back to your own preconceived biases and trainings that maybe don't even open your eyes to something because of confirmation bias. So how are you guys approaching that, and how do you view kind of this confirmation bias problem, and the role of clinical decision support to, I assume, help overcome this? Neda, you want to start?
Well,
sure.
Go ahead. Sorry.
No, please go ahead, Art. Go ahead.
No, I was going to say there are many forms of cognitive bias, with confirmation bias being one of them. But there's premature closure. There's a concept called representative bias, which we're actually very interested in. The idea of representative bias is that we teach in medicine to the classic, like we teach medical students and residents the classic presentation of the diagnosis, but then the patient comes in as a variant. So when you study the field of diagnostic errors and you look at, well, why do we make mistakes? Actually, the mistakes are made and the lawsuits happen around very common diagnoses, missed MI, missed appendicitis, missed sepsis, missed cancer. And you start asking the questions, well, why do clinicians miss something that they know? And one of the answers is representative bias, the fact that the patient doesn't present like the textbook. The patient presents as a variant. And so I'm going to let Nada jump in and add some more to that idea.
Yeah, so I mean, Art's absolutely right. There's so many types of biases that we can be subjected to in medicine. You had mentioned confirmation bias, which is another bias where if someone has a particular condition that they have in their head as what the patient has, they tend to ignore other information that might steer them away from that and select information that seems to support what they are assuming in their head as the condition. So the nice thing with an objective platform like VisualDX is you input all this information, and without these biases, it gives you a very comprehensive differential list of conditions. And then you can sort of algorithmically go through and decide based on your patient's clinical presentation and history, which of those seems to be more appropriate for the patient. And so it actually helps reduce these biases that all of us as humans are subject to.
It's such a fascinating area because AI in and of itself should help reduce bias, just like you described, assuming it's based on the right data, right? Because if it's based on the wrong data, then you're just codifying the bias into the data and into the AI engine. So it's a double-edged sword for sure. And I think there's a lot of opportunity there, and it's really exciting to hear all of this. And I love the work that you're doing, and I love that you're incorporating a vast population. I think it will be interesting to see how this evolves. I wrote probably 10 years ago from a colleague of mine who said that 10 years ago he thought that the body of medical knowledge was so complex that the human mind can't comprehend everything that's out there. And he said that a decade ago, and I think now just imagine how much it's blown up, and I think that's where we're at. So we need solutions like VisualDX to help us deal with that. And so thanks so much for sharing. And I think I might have to download the personal app too. I got receding hairline, you got skin issues, just coming like my father. But anyways, thanks so much for sharing, taking your time. And if you want to learn more, where can people go to learn more about VisualDX?
Well, you can certainly go to our website at www.visualdx.com, and you can sign up for a trial, and you can reach out to us if you're at an institution, because we bring VisualDX to hospital systems and to medical schools. We're in over half of the U.S. medical schools. We're in over 2,300 hospitals and clinics. And since the George Floyd tragedy, there's obviously been more attention in healthcare to try to reduce bias. And we've had a lot of reach out because of our historical commitment to making sure that we're equitable in information in VisualDX. So we look forward to hearing from anyone that's listening. And on an individual level, you can go to our website and also get an individual subscription to VisualDX.
Awesome.
And if I could just add to that, on the website, there's also a tab for those interested in our work to reduce healthcare disparities about the diversity of images that I was discussing with you and what VisualDX has been doing in that realm. And we're actually continuing to expand on that work, so more to come, stay tuned. But yeah, on the site, there's also a slide presentation one can download to sort of look at what Art and I were describing in terms of what diseases can even look like in different skin types. And there's very nice side-by-side images. So a lot more to look at on the website.
Excellent. Thanks so much, Dr. Papier and Dr. Ebelik. Appreciate you sharing your insights, and thanks everyone for watching. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com. Thanks.
Thanks, John. Thanks for having us.
Thank you.